Nate, she studied a Bachelor of Science in Nursing. That makes her very knowledgeable on all things NF. You may know Kate's name from her YouTube series, Ask Kate, where she answers questions that come in globally from the NF community. We're so thankful for your time today, Kate. Thank you so much.
I'm very happy to be here. Thank you, Jasmine.
Tonight, we'll also have Meredith and Ruth join us, support coordinators from the Children's Tumor Foundation Australia. We're recording this session so that it can be a resource for now and for the future. I think it's something really important. So welcome, Kate, and thank you.
So I'm going to ask a couple of questions on behalf of our NF2 community now. They are an incredibly articulate and well-informed community. But we recently had some fantastic news in Australia where Mavasi was approved on our pharmaceutical benefit scheme. So a drug that used to cost about $40,000 a year is now freely available. Which is fantastic. So our understanding is that is the biosimilar for bevacizumab. So we know that this drug is effective on vestibular schwannomas, but can you talk about the other benefits of this drug? So does it help with spinal tumours? Does it help with pain? What are the other benefits of, I guess, Avastin or this drug that is now available?
Yeah, no, that's a good question. So it does, we have seen, and there are some studies that have been published that show that it can help with those spinal cord tumors as well, that we'll see a reduction in size, which is great. In the NF2 community, a lot of times study size sample is small. And so it's really wonderful when a drug gets approved like this, because, you know, it takes a long time sometimes to get that. Well, always, it takes forever to get these things approved. So we do see that it impacts other types of tumors in NF2. It also does seem to have an ability to disrupt the pain. This is actually very interesting. There's a study here in the NF2 community that it's called the Intuit trial, and it's a platform drug trial. And what's really special about that is that normally what we do when we do a study is we say it's one drug and we're looking for one result, right? So we're looking at this drug to this type of tumor. And if in the process of doing that, you notice that it impacts other tumors, you can't do anything with that data, right? And so what this platform style study it does is that they can actually say, they can look at many different things. They can look at how this drug impacts a slew of tumor types and symptomology in NF2. And then they have the ability to kind of make a new branch of the study and pursue that, and be able to have publications off of that, which really is going to speed up those results and hopefully have a really positive impact on the community. So yes, that's why the reason they want to do this study is because we're like, okay, well, we know it helps with vestibular schwannomas, but we're also seeing that it seems like it helps with spinal cord tumors. And oh gosh, these people are in less pain. Why is that? Right. So yes, we do see that. So I don't know. I wouldn't know if in Australia, if your main issue is pain, you'd have to work with your provider as to when they would prescribe Mvasi. But we have seen really positive and promising information about its impact.
Okay, excellent. And we have 2 gamma knife machines here in Australia, but as far as we know, they haven't actually been used yet on anybody with NF2. Is that something that's used in America as a treatment option?
Yeah, so it's definitely a treatment option, but I'll say right off the bat that this is one of those things that there's a lot of disagreement. I don't know if it's even disagreement, heated discussion around the safety of gamma knife in people with NF2. It is radiation. We do worry about that with a tumor predisposition syndrome. But I have patients I talk to who they had that done, and I have patients that have been told don't have that done. And, it's a very tricky subject. And so I wouldn't be able to say, oh yeah, it's definitely, I think even in the kind of upper echelons of NF2 experts here, it's still, maybe not a go-to. In fact, I mean, that's the reason that the medications that might actually treat these tumors are so important, is because they would really like to not have to use something like Gamma Knife. But it is used here. People have had that done to treat their tumors and had, varying levels of success. So, but it's controversial, maybe is the word.
Okay, thank you. So before you go, our community are just desperate for information on research, and just if you could give us a general overview of what you think are the most sort of noteworthy and promising research studies that are underway at the moment. So you've talked about the cream, which I think people will be really excited about. Yep. We've got the MEK inhibitor trials starting here. So you're a bit further advanced in it being approved over there. But just anything else that you think is new and noteworthy that people would like to know.
Sure. So one thing is that with the approval of Koselugo, which is the selumetinib would be the general name, the generic name for that. We're now running a bunch of studies looking at, do they have to stay on it forever? What happens if they come off of it? Can we try it? Can we have off for a while and then back on? So there's a bunch of research looking at that. We're also looking at that drug for a lot of other uses. We're looking at it for NF2 tumors. We're looking at it for the cutaneous neurofibromas. Obviously, the gel is a topical option, which is fantastic, but they are actually looking at the classic pill version of selumetinib for cutaneous neurofibromas. So they're basically saying, we see that this works. Let's see if it works on all of these other things, right? So that's one thing I think is exciting, and we'll have more information in the coming years. The Schwannomatosis study that is starting up at Johns Hopkins here is really exciting. It's looking at a drug called tanezumab, and it's looking at particularly its impact on pain and whether it can be used as a treatment for pain in schwannomatosis. Because one thing we know is that often the pain in schwannomatosis does not respond to classic interventions, right, in terms of classic drug options. So that one is very exciting, and I'm looking forward. It's just getting started, so it'll be a while, but I'm looking forward to seeing what comes of that. And then I did mention briefly this Intuit platform trial. So in the NF2 community, I'm most excited about that. Just the possibility for the speed at which we could see a lot of different papers being published and results coming out, which of course then kind of speeds up that whole process from research to, something patients can access. So I'd say those are the things that I'm most excited about that are kind of coming or in the works.
So much hope for the future.
Yes, I agree, Jasmine.
We'd all like to thank you so much tonight for your time. I know it's so early in the morning over there, but your time is invaluable, and we're so incredibly grateful to have you.
Well, I really enjoyed this. I like answering questions when I can. Hopefully my children waking up for the day is not something anyone can hear. So
can't help that. Thank you so much, Kate.
Thank you so much, ladies. This was wonderful. I really appreciate it.
Please have a lovely day.
Thank you.
Bye, guys.